Good morning, all. My name is Lais Pimenta. I'm a nurse and I'm a member of the Brazilian chapter. So here we present today with my friend Gisele Foz from Brazil as well. She will mind the questions. Uh, so Brazil has sorry, the before. Yeah. Uh, Brazil has chosen its own way of hitting the universal health coverage. We have the universal health system in Brazil. Next, please. So after a social movement that came after the dictatorship, military dictatorship that we had for 20 years, we had guaranteed the health for all in the Constitution in 1988. And the universal health system in Brazil, that we call Unified Health System, SUS, was set in 1990 with the laws of the system that we call organic laws. And this health system is managed by the three-party organization that is the national level, states, and municipalities. And we also have guaranteed by the two constitutions the public management, and we have the National Council, National Health Council with the delegations for all the municipalities and Brazil institutions. So it's important to understand how the Brazilian system is organized in order to provide information about what we are doing in our chapter and how we are advocating here for gender responsive health system. So we have each 4 years, we have 3 years, we have a strategic planning, and we have ways of putting efforts to enhance the health system and deliver the better access to people in the country. So next, please. But we have many challenges here in Brazil, and we face historical challenges for funding health system and regional inequalities, especially social and economic disparities that reflects in healthy access as well. And we have, as we can see, we have a huge difference in life expectancy between the south of Brazil, southeast of Brazil, and the north and northeast of Brazil. And then we can have more than 5 and 6 years difference between life expectancy. It reflects, like, we can have an European life expectancy in the south of Brazil and in a very different life expectancy in the rest of the country. And we also face a very high maternal mortality rates, and particularly for Black women. Next, please. And so Brazil it's a huge country with 303 million people, and we have a rising prevalence of non-communicable disease in most of the country, but we also face with what we call the triple burden of disease, where we have the non-communicable disease and also still with infection disease and tropical disease, and we have high violence level, which challenges the health system. But we are also facing the aging of population with almost 11% of people with more than 65 years old. So we also have quite high racial inequality that comes from the 300 years slavery period that we have had in Brazil. And gender disparities are deeply embedded in our society that's quite patriarchal and sexist. So we face Black indigenous that are the native people from Brazil before the invasion in 1500, and we have faced also quite challenges with LGBTQI people, populations, gender inequality in workforce is a very hard problem here in Brazil, especially for nurses that have not achieved the minimum wage, for example, and have very poor conditions of work in some place of Brazil. So we face very different scenarios in Brazil, with some nurses earning very well and being able to do a great work, and some places that nurses cannot do that great work. And we also can see like Black pregnant women are almost 60% of maternal deaths in Brazil in the past decades. Next, please. So Brazilian we have efforts to address the inequality. So in 2023, the new government started the National Program for Gender, Race, and Ethnicity and Evaluation for Female Works in the SUS. We also have joined the United Nations Gender Equality Seal. We have social protection and public health strategies, such as transfer income programs, and also, but we have the public spending is not, public health spending is not that great. To achieve the 8-10%, we rely a lot on the private sector regarding, despite being a universal health system. So the public health spend is the highest level was 4.62 in 2020, but historically we have 3.5 and 4 at maximum. The necessity of the governance model is very urgent to address health inequalities. Next, please. So here is our team, and in WG8 Brazil, we are trying to tackle the challenge of women leadership, giving
you have 1 minute.
So, okay, giving visibility and aligning global national movements on gender equity in leadership to promote leadership in health, and participating in national and international events. Next, please. So we've been participating in very important events, such as the World Health Assembly, and also the World Public Health Congress in Rome, and all these events that I show here for you. Next, please. And so we are cultivating women leaders in health and being partners with nursing associations and other organizations in Brazil to overcome regressive social and gender norms, and to cultivate leadership training and give opportunities for women in health, for a new generation of leaders in health, and being women responsive system. And so we are bringing advocacy with Women in Global Health Brazil, advocate for gender equity, and collaborating with local and global partners. And our vision is an equitable, inclusive, and responsive health system for all, especially women and girls. Next, please. So thank you very much. For conclusion, our chapter in Brazil, active participation is crucial for advancing gender responsive universal health coverage, and for the importance of women's leadership in shaping futures for Brazil health system. Thank you a lot.
Thanks a lot for that amazing presentation.